Hey everyone, welcome back to my channel and welcome back for another edition of Health Class. Today we will be discussing another special topic, a health topic that is gaining much popularity these days, especially in media and social media. I'm talking about one of the autoimmune diseases that we have out there. We will be talking about lupus. Of course, who doesn't know about the Philippines' queen of all media, Miss Chris Aquino? She is currently undergoing treatments to treat her diseases, including lupus. So let's discuss lupus and what is it all about. This will be an interesting topic to discuss today. So just keep on watching. My name is Ryan and I'm specializing in diabetes, primary care, alcohol and drugs, men's sexual health, and medicinal cannabis. Just like what I told you earlier, we will be discussing lupus, or medically known as systemic lupus erythematosus, or simply called SLE. And one of the Philippines' most prominent and popular celebrity or public figure who's got the disease is Miss Chris Aquino. Like what I told you earlier, she is currently undergoing treatments to treat her diseases, and one of her diseases is lupus or SLE. SLE or systemic lupus erythematosus is an inflammatory disease caused when the immune system attacks its own tissue. We have discussed in the channel a few autoimmune diseases in the past, and by now probably you're already familiar of what an immune system is. Let's recap. The immune system's role is to fight bacteria and viruses or diseases. In autoimmune diseases, the opposite happens. The body's own immune system produces antibodies that attack the body's own healthy tissues. And this could lead to autoimmune diseases. One of them is lupus. Lupus can affect the joints, skin, kidneys, blood cells, brain, heart, and lungs. About 90% of people with lupus or SLE are women. It develops between the age of 15 and 45 years old. In children, it is usually diagnosed during puberty. It is common in indigenous people, Polynesians, and Southeast Asians. There are two main types of lupus. One is the one that we're going to be discussing today, which is SLE or systemic lupus erythematosus. SLE is characterized by flare-ups and remissions. When we say flare-ups, it means attacks. It can happen any time of the day, any time of the week. When we say remissions, that means recovery from lupus. So SLE can just happen any time of the day, any time of the week suddenly, and then it heals up, or there is a recovery. Then it flares up again, and then there is remission again. It can affect almost any organ or system of the body. In most people, only the skin and joints are affected, but can also affect the heart, lungs, kidneys, brain, blood cells, and blood veins. The other type of lupus which is not common is discoid lupus, also known as CLE or cutaneous lupus erythematosus. It is a milder condition compared to SLE. It appears as a red, scaly rash on sun-exposed areas such as the face, scalp, arms, legs, or trunk. A small number of people with CLE develop into SLE. The cause of lupus is unknown. It's the same with most or all of the autoimmune diseases. The cause is still being investigated. But there are possible triggers to lupus or SLE. One consideration is the hormones. There are also certain medications and chemicals causing lupus to happen. Viral and bacterial infections as well can trigger lupus. Exposure to UV light rays of the sun, dietary factors, pregnancy, and high levels of stress. Symptoms are unpredictable and variable. That means symptoms might not be the same for everyone, and variable because it has different symptoms for each person. But the common symptoms are joint pain and swelling, skin rashes, fever might develop, loss of appetite, fatigue, weakness, or tiredness. Early diagnosis is always important. The basis of diagnosis is on clinical symptoms. Blood tests can be organized. Specific blood test for lupus is the ANA test or anti-nuclear antibody test. It measures antibodies of tissues. But not all people with SLE have positive ANA. Therefore, these tests can only help diagnose lupus. But the most important basis of diagnosis is on clinical signs and symptoms. There are few treatments for lupus. The most common ones and easy ones are NSAIDs or non-steroidal anti-inflammatory drugs. Some of these drugs are aspirin, Nurofen, and naproxen. These drugs reduce inflammation and relieves fever. Anti-malaria drugs as well has been used. This is to reduce joint pain, rashes, and tiredness. Corticosteroids are also used. This is the drug of choice for treating serious complications of lupus, such as those affecting the heart and lungs. Immune-suppressed drugs are also used, such as methotrexate. And I think I've heard in the news in the past that Miss Chris Aquino also used methotrexate for her lupus. And then there is a group of drugs we call cytotoxic drugs, such as cyclophosphamide, which sometimes are used to treat cancer patients. There you go, everyone. This is a very basic and simple video about lupus. Remember, there are tips to help people with lupus to lead a normal life. 1. Take rests because you get tired a lot. 2. Exercise programs without becoming tired. This will help improve well-being and prevent muscle wasting. 3. Avoid sun exposure. Wear long sleeves, hats, and sunscreen or sunblocks to protect your skin. 4. Avoid contact with people with infections because your immune system is weak and there is a high chance that you get infected too. 5. Do not smoke or stop smoking if you are already a smoker. 6. Limit alcohol drinks. And 7, which is very important, visit your doctor on a regular basis for constant health monitoring. Please remember those helpful tips. Thank you for watching, and I shall see you again on my next health class. Stay safe and be healthy.